Hello, howdy, greetings, welcome back, salutations. Here we are for another chat on some pranayama techniques, and today's discussion involves the technique called Kapalbhati, or the skull shining breath, also commonly, I think, referred to as the breath of fire. So, this is a breathing technique with a forceful exhalation. That is that really the meat of it is a forceful exhalation, and it's from the belly. So you're exhaling forcefully through the belly, kind of pushing, right? Pushing the exhalation, the energy up, 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 kind of up, as you exhale. Um, the translation, right? Skull shining breath. What that sort of refers to, right? You're sort of this energy kind of pushing your energy kind of up. Imagine like into your skull shining, like you sending all this prana, all this energy up into like the skull, into your crown, into your third eye space, into your head. And it's an excellent technique that is wonderful to be used for kind of energizing your breath, kind of purifying your respiratory system, exercising your respiratory system. It has many, right? I think many people who talk about this, they will share this as maybe one of the primary techniques they give in pranayama. There are a few techniques that are very popular, right? But this is probably one of the most used, one of the more referred to pranayama techniques that people will share in a yoga class or otherwise. There are a couple of sort of core ones. I think probably the complete breath, Kapalbhati and or Vastrika, and then Nadi Shodhana. Those might be the most commonly, what I have seen, the most commonly shared or distributed breathwork pranayama techniques that people might talk about in a class. And so there's a good reason for it, right? They're very powerful, they're very effective, they're very useful for different things. And this one, the pranayama technique Kapalbhati, skull shining breath, this one really great for clearing the system, clearing things out, exercising your lungs, uh, right? Giving yourself a little bit, even like there's like a little bit of some sort of abdominal cleansing too, because you're really forcefully sort of massaging the internal organs here in the belly. So what we do, how you do it, is you exhale sharply. So through the nose. And when you inhale, also through the nose. But when you inhale, it's not so much of your attention. You don't really think about ex the inhale, but you think about the exhale. You forcefully, right, pull the belly into the spine. Exhale. Feel yourself really contracting those abdominal muscles, pulling the belly in, kind of pushing that diaphragm in up. Those abdominal muscles, right? Kind of pushing in, squeezing the belly, squeezing the intestines and everything in and up. And then when you inhale, you just relax. Just relax your belly, relax your abdominal muscles, just let go of your diaphragm. And your body kind of, as I always say, breathes itself. You're not really taking a inhale so much as you are relaxing your belly and your body is inhaling. Your body is breathing at this point, not so much as you are breathing, as it's more like being breathed. When you relax the belly, after that forceful exhale, your body will take air in again. So it'll be a few, I'll just demonstrate a couple of those for demonstration's sakes, right? So you would exhale sharply through the nose and then relax and the body breathes. So I don't really know exactly how much audio is getting picked up, right, with these headphones in, but it's like exhale, let go, exhale, let go, exhale, let go. Just let go. The body breathes in. You don't fill in the belly like deeply. You let go to inhale. And so you can do this practice, you can do this every day. And this is one where this is one of those techniques, the pranayamas, where you might want to check with a physician before you do it. This is one you don't want to have if you have heart conditions, right? High blood pressure, things of this sort of nature. There are a number of contraindications for this sort of little bit more active, a little bit more, right, kind of even aggressive, you could say, breathing technique. And so there's giant lists, many big lists of, right, should I do this technique or not? You can look down, but specifically heart conditions, sometimes respiratory issues that are um, uh, I don't heart conditions, blood pressure things. There's a big list I have not in front of me. Um, I'm willing to, right? If you have questions, please let me know, and I would, right, post some in the comments or something also, or elsewhere. Otherwise, those are the big precautions, right? Be right. You want to be sure that this is this one specifically is a technique that is going to be safe for you in your body, in your right. I think pregnancy also they say, right, don't do this if you're a pregnant person. Um, so you can do this in the mornings, great, right? Maybe right before bed. It depends on how sensitive you are to sort of energy stuff. It might like wire you. I don't know for sure, right? But in the morning, probably quite good. And this is right midday or something like that. Probably also quite good. It can sort of like energize you, can get your energy flowing, and kind of like if you're feeling a little dull, this might be something that you can use to sort of re-energize yourself back into a little bit more virility in throughout your day. It can be used. I like to use it kind of in the first earlier stages of a pranayama practice. I like to do like a Durga and then a Kapalbhati, kind of like that in sequence. First connect with my breath for a little bit, and then do a little bit of like this cleansing, purifying, activating stuff, and then do some more calming breathwork techniques towards the end after I have sort of cleansed the system. So you can do this in time. You work your way up to more and more and more. You start out with 20, start out with 30, start with 40, something like that, breaths, and work your way up. As you get comfortable, as you get used to it, you go up to, right, 40, 50, 60, 50, 60, 70, 70, 80, 90, right? Go up to 100 or something. That's all great. You could do it for lengths of time if you want to start and like you'd rather not count, but just do a stopwatch or set a timer. Do it for a minute, right? See how that feels. Do it for 30 seconds. Do it for a minute and a half. Do it for 2 minutes, 3 minutes. Great. Um, Something like that. You do a couple rounds. You do like, one set and then another set and then another set. You could do it throughout the day. You could do it sometimes even some asana, some yoga, right? Some yoga asana shapes. You can incorporate this. Sometimes people will do that in a class and they'll say, Kapalbhati in reverse tabletop or something. So what else to talk about? I think just the actual technique itself. So spine tall, shoulders relaxed, hands maybe on your knees, hands perhaps on your lap, something like this, with your shoulders kind of slightly sort of relaxed, spine tall, checking for maybe neutral to level, maybe even slightly down on the chin level, and you can start with a nice slow, deep inhale, a nice slow exhale, and then I would say count. And so maybe we'll do 30 of them. So this we're gonna do let's say 30 of them to start out with, and you just kind of see how it feels. You can do it at varying speeds. You can get faster, you can get slower, kind of find out what is your comfort level, where are you at in your practice. You get faster as you get more used to it. And you could do greater in number or greater in duration as you get used to it. You don't want to overdo it, right? But the technique itself, spine tall, shoulders relaxed, hands on the knees, hands on the lap, hands in the lap, something like this. You will take sharp exhales, pulling your belly in, and your inhales, sort of relaxing. So we're going to start this right now. We'll do, let's say, 30 of them in just a few seconds, all right? So I'm going to kind of count down 4, and then we'll start. We'll do about 30 of them, okay? So here we go. 4, 3, slow inhale, 2, 1, and go. That's about 30. Then you can return to your normal breath. Right, take a nice slow inhale, nice slow exhale. If you like, you can even do some 4-4-4-4 breaths in between rounds. Just give yourself some time to kind of recalibrate, recenter. Okay, so that was one round of 30 Kapalbhati. So um, we'll do one more just for practice's sake. And we'll do about 30 again. All right, getting the idea. And we'll do some, I think I'll share some practice videos that we can combine all these techniques together without so much talk and talk and talk. But for now, right, we're just kind of learning the meat of the technique. If you don't know the specific technique, you can come to these videos, refer to them, and practice with them too. So again, tall in the spine, relax in the shoulders. And as you do this technique, relax everything you possibly can except the abdomen, right? Shoulders relaxed, arms relaxed, hips relaxed, thighs relaxed, hands relaxed. If it helps you to maybe flare your nostrils if it's necessary because you feel like there's a little bit of blockage, right? Flare your nostrils a little bit, that's fine. Okay, here we go. And we're going to start round number 2. 1, 2, deep inhale, and go. That's number 30. So again, return to a nice calm breath. Deep inhale, maybe 4-4-4-4. Inhale, hold, exhale, hold. Okay, so thank you for this short little discussion and experiential practice of the Kapalbhati, skull shining, or breath of fire. See you next time. Bye-bye.